Hi, I'm Dr. Anita Krishnan, Consultant ENT Surgeon with over 30 years of experience. I practice out of Bangalore ENT Care Centre, Koramangala. My areas of special interest is airway allergy, allergen immunotherapy, airway disorders, and general ENT disorders. Today, I want to talk about chronic ear discharge. If your ear is discharging for months, it's not normal. Most of us tend to ignore it if there is no pain. But if it is discharging, it means there is secretions or pus being produced somewhere behind the eardrum and it is oozing out, or it is oozing out from the ear canal. It is very important to consult a doctor about this situation. In medical terms, we call it chronic suppurative otitis media, and there are two types. One is the safe type of disease or the tubotympanic disease, and the other is the unsafe type of disease or the atticoantral squamous type of disease. Now, in the safe type of disease, what happens is that there could be a hole in the taut part of the eardrum called the pars tympanica. In the unsafe type of disease, there could be a hole in the pars flaccida, or the pars flaccida itself may be getting pulled inside and moving towards the upper part of the ear, which is very close to the brain. And this will start producing a kind of bone-eating secretion called cholesteatoma. Cholesteatoma is like a locally invading tumor. It eats up the bones around and it can even reach up to the brain. That is why it is called the unsafe type of disease. It is very important to address these things, because if you have a hole in the eardrum, there is a possibility that the ear will continuously discharge if water goes in or when there is a cold or cough, and recurrent infections may cause the small tiny bones inside the middle ear to get fixed or to get eaten up and eroded, bringing your hearing down. These things can be sorted out with a simple surgery, and it is important that the surgery is done at the right time, especially in the unsafe type, the atticoantral type of disease, where the disease, if extensive, causes extensive damage inside the ear to the hearing, to the balance organ, and even to the facial nerve, causing a facial weakness. So do not ignore a leaking ear. Please consult an ENT. Thank you for listening.